Is your daily workout boosting your well-being or rapidly pushing you towards burnout? Overtraining can sneak up on even the most seasoned athletes and exercisers, leaving them fatigued, injured, and mentally drained. And in my clinical practice, I regularly see people struggling to balance their passion for fitness with their body's need for active recovery. Today on The Health Perspective, I'm welcoming back Amanda Mimoni, co-founder and lead physiotherapist at the Physio Rooms. Amanda has dedicated her career to guiding her patients to their peak condition, helping them avoid common issues like injury and exercise burnout. Today, we'll explore how to spot the early warning signs of overtraining, practical strategies for rest and recovery, and how to keep exercise a positive force in your life. Amanda, welcome back.
Thank you for having me.
Let me start with a broad question.
Sure.
Do you see people struggling with too much exercise?
Yeah, for sure. I think really over the past 5-10 years, what I've seen in practice is that exercise has become such an integral part of people's daily life, whether that's for their mental health, whether it's for aesthetically they want to look better, whether it's for like an inflammatory condition or like a joint condition. We understand more and more how important exercise is. And I think what's happening now is that people are like, right, exercise is so important, I need to do it every day. And what's now happening is you don't want to give that up. So I'm seeing it more and more, that exercise burnout and fatigue for sure.
And what do you see? So as a physiotherapist, kind of what are those signs that you're looking for in a patient?
For me, the first sign really is that their program. Like when they come in, it's like you're listening and you're understanding what it is that's brought them in. So it's usually for me like an injury or pain. And I'm trying to like understand more about their pain, what they're doing. And it's then hearing, well, I'm exercising every single day because I need to, because of the condition I have, or because I'm trying to achieve a goal. And then from there, that then bleeds into their mental and physical well-being. So poor recovery, poor performance, they're not achieving what they want. And then that will lead to things like poor sleep, poor appetite. So that's what I see in clinic.
So you're looking at the whole person.
For sure.
Well, that kind of holistic
Yeah, 100%.
approach.
I think that's what the most important part with exercise burnout really is that it's not just that they're exercising too much, it's what then happens from that.
So this is an important point for me, is that exercise burnout is a real thing.
Oh, for sure.
Yeah. How common do you think it is?
I think it's far more common than what I see. And I think it's becoming more and more common. And as I said, because of how integral exercise is within society now. And I think we don't want to give that up. We don't want to having that, what we call a rest day. I think it feels like then we're not doing anything, right? So people don't want to give up their exercise routine. They don't want to give up their plan. They feel like they're not going to achieve their goal, which will then lead to that burnout. So I think it's becoming more and more common. Is it something that you see in your practice?
Yes, absolutely. I think that the focus on exercise and well-being is immensely positive, and I think people exercise a lot more. And when I was a kid, I don't remember kind of lots of my parents or my parents' friends doing lots of exercise, or talking about exercise or buying athletic equipment and so on. And now it's really culturally ingrained. But I think that we're learning to rely on exercise. And I see a lot of people who are very reliant on exercise for their mental health, which is, of course, a good thing. Mm-hmm. But there's quite a lot of anxiety about what happens if they can't exercise. And so quite often I see people who have sustained an injury of some kind, or they've got to have an operation, but let's say they've just sprained their knee or something like that, and they can't exercise, and actually they get into quite an anxious state because of the fear of what will happen to me if I can't exercise. Is that something you see as well?
Oh, for sure. I think what I'm seeing at the moment especially is that people have had like knee injuries from skiing, especially this season, and they come in and they're like, well, what am I supposed to do? Like, I need to exercise and I can't. And then the consultant that's referred them for orthopedics is like, right, like you're off now for at least 12 weeks and then you're going to have your rehab. But people just don't want to hear it because of how important it is for their day-to-day life and for them to feel like mentally they're better, physically they're stronger. So yeah, it's something that I definitely see, and it's something that I have to work alongside the patient to really help them be like, right, so if it's a knee, you're not going to be able to do your lower limb exercises in the gym. How can we work around it so you still feel like you're achieving something? And then also, are there any other tools that we can incorporate into your daily life now that can make you feel like, I may not be able to exercise the full potential that I want to, but how else can I get that, like, the clarity for their mental health and for that feeling of like, right, I feel better, I've done something for myself, but it's just not what I'm used to doing.
So, I mean, and on this channel, obviously, I'm really keen to give people practical take home. So what are those kinds of tools that you can offer people, or that you do offer people?
So firstly, it's always looking at the program. So if they've come in, just say, for an injury because of running, or because they're pushing too hard at the gym, or they've got some inflammatory or underlying arthritic condition, it's like, well, looking at what their program is today and how can we alter it that they can carry on with a type of program, but they're not pushing too hard that will lead to burnout. Looking at other tools, if they're using exercise as a way to help with their mental health, what other tools are out there? And there's so many, right? You've got therapy that you could do, you've got journaling, you've got mindfulness meditation. And I always say to patients, like with meditation, it's the type of thing that you've got to find someone you like, because quite often you go on YouTube and there's like 1 hour meditations, the accent that you don't like, it's too long, it's too difficult to try and really get into it, but just shop around and you'll find that one you like and use that as a really good tool. And also like get support. There's like, because exercise burnout is such a thing, there's so many people suffering, with it, but also who are going through it, right? So if you can't run, but you can go on a walk, find a friend to go on a walk with. And that will really help. And I also think, speaking to professionals, there's like so many people out there that like physios, personal trainers who can help with programming that will make you feel like you're not losing everything just because you have to slow down. Because there really are ways around it, and ways that you can feel like you're improving, or ways that you feel like you're improving with like your performance or whatever it is that you're trying to achieve, but in a much healthier way.
In your experience, what is that healthy balance between, I think we're all obsessed with fitness, increasingly we're all wearing our fitness trackers and all of, and all of that.
Sure, we've both got ours on.
Got ours on, so I think mine just beeped actually telling me to move. We're increasingly kind of data focused, but what is, in your opinion, the right balance between rest days and exercise or active days?
So I would say that to finding the right balance, it's firstly, what is it you're trying to achieve, right? So what is that person trying to achieve? Are they trying to run the marathon, lift heavier at the gym, help avoid the pain that is kind of like they've got a knee pain, a hip pain? What is it that they're trying to achieve? And then looking at the program and being like, right, like I need to make sure I fit in 3 runs a week or 2 gym sessions a week with at least 2 rest days per week. And I think the word rest days scares people. I don't know if you found that. Like when you tell someone, oh, go on a rest day, they're like, but I'm not going to be able to do anything on that day. Like, how am I meant to cope? Calling it active recovery is significantly better, because it's like, well, no, like on those 2 days where you're not going to be able to hit the gym hard, to go for that run, if you just go for a really nice walk, go for a swim, do some yoga, some stretching, some ability work, it will have a much better like feeling towards it, whereas in saying that you absolutely need to stop.
I like the term active recovery. I probably am guilty of using the term rest days a bit too much, actually. I really like the idea of starting with where you want to be, and I think that's something that many of us, I definitely get that wrong, is in that I exercise regularly many days, but because like most people I function like, live with quite a lot of stress and I'm constantly kind of behind the curve on many things, I exercise because I know it will make me feel better on the day.
Sure.
So I wake up and I'm like, where am I going to fit exercise in today? But rather than looking at, so I'm not training for a marathon or anything, but actually rather than looking at an overall plan, And for me, the plan is that exercise is just to keep me fit and healthy. I'm not working towards any specific goals or gains. So I think I like that idea of actually thinking about where you're overall going. Personally, I found that when I take regular active recovery days rather than rest days, I get quite a lot more out of my exercise days as well. And I think the overall week, I think the difficulty is that sometimes on those individual days, you may not feel exactly the same as the days you exercise. But when you look at the overall week, I think my week goes better when I take those days.
Yeah, because if you don't mind me asking, so the days that you're if you're exercising every day, how do you feel towards that? And like, if you found that you had that difference with, I'm going to take a active recovery, a rest day, and you found that your week was better, how was your week better compared to when you were exercising, just say 7 days a week with no break?
I think probably there's less exhaustion overall. And I think that brings me on to the other problem that I see a lot of, is that people trying to exercise their way through burnout and through increasingly low mood. And that's something I see a lot. And it's really tricky because, again, exercising isn't wrong. And there's so much information out there about the positive benefits of exercise for low mood and for burnout. But the problem is often with burnout is that your body's energy levels are not where they need to be, and they're dropping over time. And I see quite a lot of people who start feeling that kind of, those early signs of burnout, so fatigue, kind of resentment, kind of not feeling refreshed in the morning, and they start pushing harder and harder into exercise, but like intense exercise, like, 40 minutes of spinning or an hour spinning. And it gets them to the point that they come in to see me and literally in tears and completely, utterly exhausted because they've been trying to exercise their way through what is a more complex situation. And I think that they needed a lot more of a mixture between exercise and active recovery than just exercise.
For sure. I've definitely been that person that has tried to push through exercise burnout. So for me, one of the main reasons I exercise is because I love it and it makes me feel really good. And my days are manic. I'm like in clinic by 7:45. I'm home by 7. And for me, that I like waking up really early at about 5:00. I'm up and I'm like, right, the world is still asleep. I have my 1 hour to myself. And in that time, I just want to exercise, right? And then I finish work and quite often I'm like, okay, is there anything else I can do? Because it just gives me my time to make me feel good. I'm starting my day and I'm feeling more empowered. I'm doing something positive for myself and it makes me feel more alive. I can concentrate and I can now treat my patients because I've done something good for myself. But what was happening is that work is so busy. So I'm trying to manage running a clinic. I'm trying to achieve my personal goals, which is like the exercise. I was trying to run a half marathon at the time. And then also trying to have a personal life outside that with like family, my husband. And what I found is that I was just burning the candle at both ends. And I didn't want to give up my exercise every day because if I want to run a half marathon, I have to do my strength training, but I don't want to give up my reformer Pilates because I love it. But I remember it was over Christmas, I just kept getting sick. And I'm like, I just don't understand. Like, why am I keep getting sick? I'm not sleeping. I wasn't performing well with my exercise. I wasn't performing that well at work. I was finding everything becoming too stressful. And I ended up going to the GP being like, this is literally the 4th time I'm sick again. Like, I don't understand why. And actually, when I look back at that time, I was just trying to achieve everything, pushing it really hard with the gym and with running because I love it and I don't want to give it up. But actually looking back at that period of time, all I needed to do was just pull back just slightly, allow myself to sleep better as well, because sleep is hugely impacted during that period. Like, I wasn't eating as well because I'm just so tired. So I think actually, however good it is for the mental health, I think people understanding if that overtraining can actually have a negative then impact on that is also so important. Like, now, when I speak to patients, family or friends who talk to me about it and they're like, I'm just pushing really hard. Like I need to do it. You don't understand. It's so good for my mental health. And it's like, just be careful.
Yeah. I really appreciate you telling your story. I think it's really helpful because it completely breaks the stigma when people realise that professionals
Oh, for
who
sure.
are experts in exercise still get it wrong. Like, we all get it wrong. As in,
Oh, of
doctors
course.
struggle with mental health conditions, you know, physiotherapists struggle with exercise burnout. And I really like the other thing you said as well about that you only had to pull back a little bit. I think people worry that, certainly when I counsel people who are going through that, I think they sometimes misinterpret what I'm saying to, you have to reset your life, give up running and just take up kind of meditation and mindfulness retreats. Whereas, well, I guess I'll pose the question to you, is how much did you have to pull back, like in terms of percentage or whatever, just to make that shift into a better place?
So when I was doing it at the time, I was probably running around 3 times a week, aiming for the gym 3 times a week. And then if I could fit in a reformer Pilates, and it was actually like, no, you're going to pull back. And I did about 5 days of working out with 2 active recovery days. So I still went for my early morning walk, or actually I used that time to do my admin. It was like the most, and now I literally live for that. I wake up at like 5ish and I'm like, well, great time to be awake and do admin without anyone getting in the way.
I'll leave that one to you.
So I found that adding in 2 rest days was what I needed to do. And that's what I always recommend to people. So if you're going to like the athlete level, right, they usually will do around 1 day. But for people who kind of day to day are using exercise as a goal for mental health, or for they want to try and achieve something like a half marathon, I would always recommend 2 rest days a week, but split as well. So what I often find with people is that they'll be like, right, Monday to Friday, I'm going to go really hard. Right, that's when we're working. That's when we want to achieve our goals. Right. So on the weekend, we're like, sit back and we're like, okay, we're done now. We can relax. Or it's the other way around. They'll
I feel
go,
like you're talking directly to me now.
Yeah, I'm going to give you some advice now. Or they'll go really hard Thursday to Monday because they can get really good workouts on in over the weekend, and then have like 2 rest breaks in the middle of the week. Okay. But actually, I would not say that's the best way to do it. You want to split them up. You want to probably do 3 days on and a day off, and then go back in that cycle again. Because otherwise you're just going to be 5 days going really hard. And towards that 5th day, at what point has your body had a chance to recover?
That's what I notice in myself.
Yeah.
I think I can exercise regularly for 3-4 days, but on coming towards the 5th day, there is just a slightly different level of fatigue.
For sure. And I also think it's important. The risk of injuries with fatigue is also I think what is important for us to tell our patients and people as well.
So if we're going to give some take-home messages today, I guess, in terms of symptoms, in terms of what you see, what are your key take-home messages for people to kind of prevent injury, reduce the risk of exercise-related burnout?
I would say that no one is saying to give up what you enjoy. And I think I had to teach myself that as well. We're not saying give up what you enjoy. What we're saying is just pull back slightly, as I said, by adding in 2 rest days a week, split throughout the week, and use that time to do something a little bit different. Make it what you enjoy so you're happy with that, whether it's, as I said, we spoke about mindfulness, meditation, journaling, going for a walk, going for a swim. And then also tracking, I think, is also a nice way to do it. So if you can start to feel symptoms of fatigue, exhaustion, you're not performing well, you can feel yourself feeling a bit off, or you're worried about injury, or you're not eating as well, track what you're doing so you can monitor how well it's going. And if you can then start to spot the signs, that will also help you feel like, okay, fine, I think I'm actually hitting burnout. Maybe I need to have another rest day this week. So it's like implementing, tracking, and then allowing changing to make sure it doesn't happen. So you're understanding your body more.
Yeah, I like that. I mean, I think tracking is really difficult because I think we all over-track a bit nowadays. But I think what you're talking about is more of a gentler kind of form of tracking.
Oh, for sure. Yeah.
Just listening to your body.
Absolutely.
Too many of us listen to our kind of our fitness trackers.
Oh, no, not that. As in, like, are you sleeping? Are you getting
exactly,
enough sleep? And are you eating well?
Yeah.
And like, how's your training going? So I think it's just more mindfulness about yourself rather than using like your watch or an app to track. Yeah.
Listening to your body. I think that's absolutely key. I think we can become so focused on the data from our fitness trackers that we forget to just listen to the signals our body is telling us. And sometimes actually the signals are not to exercise today.
Oh, for sure. Your watch just told you to stand up. Imagine if you're exhausted, you'll be like, no.
Stand up now. That's been really helpful for me, especially. I'm just going to go home and probably take down a lot of that and actually practically apply it to my life. Thank you so much for coming back. Just tell me a bit about your work and what's next for you and what you're doing at the moment.
So at the moment, I'm chairing a new clinic with Naomi Burns. So we've started a physiotherapy clinic in September, and we're really now at the point of expanding the clinic. So we're looking for new physios, we're looking at over the next year gym space, and we're really just wanting to grow the clinic and have like far more physios and patients that we can treat.
I guess bring some of that really holistic care and viewpoint to your patients. Continue bringing
it 100%. I think what we're, as a clinic, really as the Physio Rooms are really focused on, is that our whole aim is to like, how can we get people to where they want to be? Because really what we see is that they get told, no, patients get told, nope, you can't do this. And our clinic is very much like, well, why? If we can help someone get where they want to be, that's the best thing that we can do. So working with a patient and helping them achieve their goals, helping them achieve their function holistically is the best way and the best thing that we can do.
Sounds amazing. I think the advice you've given has been incredibly helpful, and your patients are lucky to have you.
Oh, thank you.
Thank you very much for joining me.
Thank you for having me. It's been a pleasure.